Hi everyone, welcome back to osteology classes. Today I am going to begin the osteology of hip bone. Hip bone is a large irregular flat bone which is shown in my hands, you can see here, and it is in the region of hip, and it is formed by the fusion of three primary bones called as ilium, ischium and pubis. So let us understand, this flat, long, enlarged part is the ilium. This thick posterior part is the ischium and flat anterior part is the pubis, and we can see a large opening below this cup shaped structure. This large opening is called obturator foramen, and this cup is called as the acetabulum, where ilium, pubis and ischium meet in the floor of acetabulum. Side determination. The acetabulum should be directed laterally because this cup shaped acetabulum articulates with the head of the femur to form hip joint, and obturator foramen should be below the acetabulum, it lies below the acetabulum, and flat expanded ilium is directed upwards, and pubis is anteriorly present, thin pubis which is directed downwards and anteriorly, and pubic tubercle and anterior iliac spine, they both should be in same plane. So if you touch a vertical plane, the anterior superior iliac spine is the anterior end of the ilium here. This is the pubic tubercle which is the projection from the pubis. Both should lie in a same vertical plane or same coronal plane, and ischial tuberosity occupies the lowest and posterior part. This thick is the ischial tuberosity. So let us understand the features and attachments of each part. So starting with the ilium is the upward projected part, and it forms continues into the floor of the acetabulum, and it is fan shaped, a plate of bone, and it presents the iliac crust. The upper margin of the ilium is called as iliac crust, and the iliac crust is got the anterior end is the anterior superior iliac spine, the posterior end is the posterior superior iliac spine, and iliac crust is divided into anterior 2/3, ventral 2/3 and posterior or dorsal 1/3. This is the sloping surface, dorsal 1/3, and inner surface, this is the iliac fossa which is the iliac surface, and posterior to the iliac surface we are having sacroiliac region where it articulates with the sacrum to form sacroiliac joint, and lateral surface is called as the gluteal surface which provides attachment to gluteal muscles. We will start with the iliac crust. Iliac crust, we know anterior end is called anterior superior iliac spine. Below the anterior superior iliac spine there is a faint shallow notch, and below it one more projection is there. This is called anterior inferior iliac spine. Anterior superior iliac spine provides attachment to one muscle and ligament. Anterior inferior iliac spine also provides to one muscle and ligament. The muscle which is attached to ASIS, anterior superior iliac spine, is sartorius, and it also provides attachment to inguinal ligament. So the muscle is sartorius and ligament is inguinal ligament. Anterior inferior iliac spine gives attachment to straight head of rectus femoris and iliofemoral ligament. So a straight head of rectus femoris and iliofemoral ligament attaches to anterior inferior iliac spine. Let us see the ventral 2/3 of the iliac crust. Ventral 2/3 of the iliac crust is divided into outer lip, inner lip and intermediate area. So the outer lip, this outer lip, it gives attachment to external oblique muscle. So external oblique muscle is the only muscle inserted to the iliac crust, and intermediate iliac crust, intermediate area gives origin to internal oblique muscle, and inner lip will gives attachment to transversus abdominis muscle. And outer lip along with external oblique, it also provides attachment to tensor fascial lata. So anteriorly little part of the outer lip gives attachment to TFL, tensor fascial lata, and also to latissimus dorsi muscle. Intermediate area we know internal oblique muscle, inner lip transversus abdominis muscle. Inner lip gives attachment to the transversus abdominis muscle and also to quadratus lumborum muscle. So, these are the muscles attached to the ventral segment, that is the anterior 2/3. Let us see the dorsal segment, the posterior segment. The dorsal segment gives origin to gluteus maximus and erector spinae. Laterally gluteus maximus, medially erector spinae muscle. By now we know this bone is the right hip bone because the acetabulum is laterally projected. Posteriorly we are having the ischial tuberosity, anteriorly the pubis is present, and upper expanded part is the ilium, and obturator foramen is below the acetabulum. So, this is the right hip bone. Let us understand the borders of the hip bone. There are three borders. The anterior border extends from ASIS, that is the anterior superior iliac spine, till the upper margin of acetabulum. This is the anterior border, and we know anterior inferior iliac spine. We already discussed that it provides attachment to rectus femoris, straight head of rectus femoris, and iliofemoral ligament. Posterior border from posterior superior iliac spine extends till the ischial tuberosity. This is the posterior border. This is the greater sciatic notch, this is the lesser sciatic notch, this is the spine of the ischium. This is the ischial spine, and this one is the ischial tuberosity. So, this is the posterior border. It extends till the posterior border of the ischium. Medial border, this is the medial border on the medial side, separating the iliac fossa and sacroiliac joint, that is articular surface from the sacroiliac joint. So, this border is the medial border. It extends from the iliac crest to the iliopubic eminence. This eminence is called as iliopubic eminence. It separates the iliac fossa from sacropelvic surface. This is the sacropelvic surface, this is the iliac fossa. So, this border separates the iliac fossa from sacropelvic surface. Let us see the muscle attachments on the medial side, that is the iliac fossa. Iliac fossa provides attachment to iliacus muscle. The lateral surface is called as the gluteal surface. Gluteal surface is faintly, you can imagine 2-3 gluteal lines, anterior gluteal line, posterior gluteal line, and inferior gluteal line. So, this area, the anterior part, this area provides origin to gluteus minimus muscle. The middle part between the anterior and posterior gluteal line, this part will provide origin to gluteus medius muscle, and posterior to the posterior gluteal line, the posterior most part provides origin to gluteus maximus muscle. And just above the acetabulum, the area above the acetabulum here where my finger is present, this part provides attachment to reflected head of rectus femoris. So, already we know straight head gets origin from anterior inferior iliac spine, reflected head gets origin just above the acetabulum below the inferior gluteal line. So, where my finger is there, that part gives origin to reflected head of rectus femoris muscle. The sacropelvic surface, this rough part is the sacropelvic surface. Sacropelvic surface, this upper rough part, it provides attachment to sacroiliac ligaments. And whereas this articulating, which is ear like, which is called auricular surface, which articulates with the sacrum, allow of the sacrum to form sacroiliac joint. The pelvic part of the sacropelvic surface is smooth, this part, it provides origin to obturator internus. This part provides origin to obturator internus muscle. Next we shall move on to ischium. Ischium, this thick posterior part is the ischium. It has got the anterior, this anterior border which forms a margin of obturator foramen, posterior border, and laterally this is the lateral border. So these are the three borders of ischium. This is the body of the ischium. The upper end unites with the ilium. You can see the upper end, it is continuous with the ilium, and the anteriorly the ischiopubic ramus is continuous with the pubis. The upper end is also continuous with the pubis. Here we can see the ischial tuberosity is faintly divided into upper quadrangular area and lower triangular area by a horizontal line, and upper quadrangular area is further divided by an oblique line here into medial and lateral parts. This is the lateral part near the acetabulum, this is the medial part. So lateral, this is the lateral part of upper quadrangular area. It gives origin to semimembranosus muscle. Here semimembranosus. And the medial part of upper quadrangular area, this part gives origin to semitendinosus and long head of biceps femoris muscle. And lower part, if you see this lower part, this is the inferolateral inferomedial part. Lateral part gives origin to adductor magnus, that is the ischial part of adductor magnus muscle. And one thing we have to know, inferomedial part, it is just covered by fibrofatty tissue and connective tissue, and this part does not provide attachment to any muscles. The anterior margin of the ischial tuberosity, we know it forms a margin of obturator foramen, so it gives attachment to obturator membrane. And posterior margin is attached to sacrospinous ligaments and levator ani muscle and coccygeal muscle. So posterior border you can see here, which is continuous with the ilium. This is the posterior border, which gives attachment to sacrospinous ligaments, levator ani and coccygeus, which forms the pelvic floor muscle. And here is the lateral border. Lateral border lodges the tendon of obturator externus. So obturator externus is, after gaining its origin along the outer margin of obturator foramen, it is lodged along the lateral border of ischial tuberosity. The outer surface along the margins of obturator foramen is called femoral surface, which provides origin to obturator externus and quadratus femoris muscle. Whereas the pelvic surface of ischial tuberosity, it provides origin to obturator internus. We can see the obturator internus, and also it lodges the tendon of obturator internus muscle. Now we shall continue with the pubis. So that was about the ischium. Next the pubis. We can see the pubis is the flat bone here, and medially it articulates with the pubis of the opposite side to form pubic symphysis, and we can see it is separated from the ischium by obturator foramen, and this is called as inferior pubic ramus. The upper connection is called superior pubic ramus. It has got the anterior surface or femoral surface, posterior surface is the pelvic surface. So upper part of the pubis is thickened to form a crust, which is called pubic crust, and lateral end of the pubic crust is elevated, which is called pubic tubercle. So this is pubic crust, and the pubic crust here, it gives origin to rectus abdominis muscle. So rectus abdominis muscle, medial and lateral head gets attached to the pubic crust. Pubic tubercle gives attachment to inguinal ligament. Inguinal ligament attaches to the pubic tubercle. Anterior surface of the pubis provides origin to all adductor compartment muscles. So anterior surface we can remember as adductor longus, gracilis, adductor brevis and obturator externus. So these are the muscles gaining their origin from the anterior surface of the pubis. Repeat. Posterior surface is the pelvic surface, which is related to the urinary bladder of the pubis, and it gives attachment to the ligaments associated with the urinary bladder. Medial surface, we know it articulates with the pubis of the opposite side to form a secondary cartilaginous joint, which is called as symphysis pubis. And here is the superior ramus of the pubis. which is triangular in cross section. So, this is the superior ramus. It has got the posterior, this posterior sharp margin, this is the pectineal line, then the anterior border, this is the obturator crust, and the inferior border. So, starting with the pectineal line we can divide into medial part and lateral parts. The medial part of the pectineal line provides attachment to lacunar ligament and reflected part of inguinal ligament, which are the continuations of inguinal ligament. We know the inguinal ligament attaches to the pubic tubercle here. So, the same inguinal ligament extends medially to form lacunar ligament and reflected part of inguinal ligament, and this pectineal line medially also provides attachment to conjoint tendon and fascia transversalis. The lateral part, this is the lateral part. The lateral part gives attachment to ligament of Cooper or pectineal ligament, which is also the modification of inguinal ligament, and it also provides attachment to pectineus muscle and pectineus fascia. Sometimes the psoas minor may also attach to the medial side of pectineal line if it is present. If the psoas minor is present, it attaches to the medial side of pectineal line. Next, about the anterior border, the anterior, this thick crust is called as obturator crust. It extends from the pubic tubercle, this is the pubic tubercle we all know of, and to the acetabular margin. So, this is called as obturator crust or anterior border. Next, about the inferior border, this is the inferior border which provides attachment to obturator membrane. It provides attachment to obturator membrane. Pectineal surface, from the upper surface pectineus muscle gets origin, and from the posterior pelvic surface between the pectineal line and the inferior border continues medially to form the pelvic surface of the pubis, and it is covered by the peritoneum. So, it is smooth, it is normally covered by the peritoneum. Next, about the obturator surface, this inferior notch, this is the obturator surface. The obturator surface, where the obturator nerves and vessels traverse through this obturator groove seen on this surface. So, this is the obturator groove where obturator vessels and nerves traverse through this groove. Inferior ramus of the pubis, it extends downwards laterally and the lower part of the body of the pubis to join with the ramus of the ischium to form a conjoint ischiopubic ramus. So, this is called ischiopubic ramus. And ischiopubic ramus, we know laterally adductor magnus gains origin. The adductor part of adductor magnus attaches to the ischiopubic ramus. Next, about the obturator foramen. The obturator foramen is oval or larger in males and it is triangular in females. So, we can see it is little oval and larger, it may be the male hip bone. If it is triangular and smaller, then it is a female hip bone. Next, about the acetabulum. Acetabulum is a cup shaped cavity where it is present on the lateral side, outer surface, and it is present in the middle constricted part of the hip bone. The margins, it gives attachment to the acetabular labrum, which increases the depth and congruency of acetabulum to accommodate the large head of the femur, and inferiorly we can see the margin is deficient. This is called as acetabular notch, and which is bridged by a transverse acetabular ligament. So, this is how the transverse acetabular ligament attaches, bridging the acetabular notch, and the notch is converted to acetabular foramen because of the transverse acetabular ligament. Acetabulum receives the head of the femur to form hip joint, and acetabulum presents a horseshoe articular surface which is also called as the lunate surface, and the non-articular central part, this is the non-articular central part of the acetabulum. The acetabular fossa is filled with the pad of fat, and the lunate surface is covered by hyaline cartilage. So, this completes the attachments and features of. Continuing with the clinical aspects of hip bone. So, the first condition here is the weaver's bottom, which is also called as ischial bursitis, also called as ischio-gluteal bursitis. So, weaver's bottom, which is very common in the weavers, where in this condition it causes the pain in the buttocks because of prolonged sitting, and it is caused by the inflammation of ischial bursa. So here in this image we can see the ischial bursa over here. So bursa are nothing but the fluid filled sacs which are meant to reduce the friction. So here the ischial bursa, it reduces the friction between the hamstring muscles and the bony prominence of the pelvis, which is the ischial tuberosity, over which we usually sit. So prolonged sitting leads to ischial bursitis, which is called as weaver's bottom, and it causes the localized pain in the buttocks region, and it increases due to repetitive extension. The next clinical aspect is the bone marrow biopsy or bone marrow aspiration. Bone biopsy is a procedure in which the bone samples are collected with a special biopsy needle. So here in this image we can appreciate the biopsy needle collecting it from the ilium, that is the iliac crust, which is often used site for collecting bone biopsy. So bone biopsy involves the outer layer of the bone, and unlike bone marrow biopsy, which involves the innermost part of the bone. So here bone biopsy involves the outer part of the bone, bone marrow includes the inner part. So this is the bone biopsy used to be done here, bone marrow is done here. So bone marrow biopsy and bone marrow aspiration, it is often done in iliac crust to find out if the cancer or any other abnormal cells are present. And bone biopsy involves the outer layer of the bone, unlike bone marrow biopsy, which involves the innermost part of the bone. So the commonly used site for injecting the needle is the posterior superior iliac spine from the posterior side, which lies at the level of second sacral vertebra and marked on the surface as a small dimple on the lower part of the back. So thank you. This completes the osteology of hip bone.